classification system. The GCNDE recommends being familiar with the old and new classifications for the INBD during this transition period. The major change lies in the establishment of the four main categories of disease processes: periodontal health and gingival disease, periodontitis, peri-implant disease and conditions, periodontal manifestation of systemic diseases, and developmental and acquired conditions. After assessing the overall disease, its severity is determined by process code staging. Lastly, the disease will be assessed for risk factors, therapeutic outcomes, and rate of progression in a step code grading. Periodontal health and gingival disease. Generally healthy, soft and hard tissue around teeth. One or two sides may have some gingival inflammation. Minimum BOP smaller 10% of size, and periodontal PD smaller 3 mm. Intact periodontium, no attached loss or bone loss. Reduced periodontium can have a previous attached loss or bone loss due to either history of periodontitis, however, currently stable or no history of periodontitis. If patient had, for example, a crown lengthening procedure, patient has minimal BOP and PD smaller 3 mm. BOP, PDE. Gingivitis, BOP, edema, minimum BOP smaller 10% of size, PD smaller 3 mm, periodontal stability, no progressive attachment or bone loss. Periodontitis, periodontal tissue is lost due to plaque which causes host-mediated inflammation, often deeper PD interproximal attachment loss. Staging describes a severity, complexity, and extent of the disease, and is measured from slight to severe in stage 1 through 4, respectively. It is static measurement that measures the amount of destroyed or damaged tissue due to periodontitis. There can only be one stage per patient, so the most severe applicable option is used. Severity usually based on worst interdental CAL. Clinical attachment loss site: 1-2 mm stage 1, 3-4 mm stage 2, 5 mm stage 3 or 4. Radiographic bone loss can also be considered. Coronal third stage 1, coronal third stage 2, at past middle third stage 3 or 4. Of teeth loss from periodontitis can also be considered. No teeth loss stage 1, no teeth loss stage 2, a smaller below 4 teeth lost stage 3, more 5 teeth lost stage 4. Complexity based on PD, periodontal smaller 4 mm, horizontal bone loss stage 1, smaller 5 mm, horizontal bone loss stage 2, more than 6 mm, vertical bone loss furcation stage 3, more 6 mm, occlusal trauma by collapse stage 4, automatic stage placement, vertical bone loss smaller, more 3 mm, stage 3 or 4, furcation involvement class 2 or 3, stage 3 or 4, smaller 20 teeth remaining, stage 4. extent and distribution based on teeth involved, as this measure does not receive a stage but distribution pattern. Smaller 30% of teeth involved localized, more 30% of teeth involved generalized. Molar incisure pattern molars and or incisors are exclusively involved. Classic localized aggressive periodontitis. Grading. Grading is measured based on changes over time as well as risk factors and responsiveness to therapies. Each patient is given a grading from A to C based on several factors. Clinicians should initially assume grade B, then shift to A or C if applicable. The grading may change over time. CLA or BL, no loss over 5 years. Grade 3A, smaller 2 mm loss over 5 years. Grade B, more 2 mm loss over 5 years. Grade C, radiographic bone loss. More smaller 0.25 grade 1, 0.25 to 1 grade B, more 1 grade C. Phenotype: plaque exceeds bone loss grade 2A, plaque consistent with bone loss grade B, bone loss exceeds plaque grade C. Smoking, non-smoker. Smaller 10 cigarettes per day, more 10 cigarettes per day, grade A, B, C. Diabetes 7%, ABD none. C-reaction protein marker inflammation 1, 2, 3 mg per L, grade A, B, C. Peri-implant health, no signs on inflammation or BOP. Oral implants, probing depths should be less than 5 mm. Pre-implant mucosity, visual signs of inflammation or BOP around implants. Probing depths greater than the baseline compared to the previous year recording. No sign of progressive implant bone loss. Pre-implantitis, visual signs in inflammation or BOP around implants. Probing depths greater than the baseline compared to the previous year recording. No sign of progressive implant bone loss.